Okay. Hi, everybody. I'm Dr. Helen Malherbe from Rare Diseases South Africa. A huge welcome to everybody. Thank you for joining us. Apologies for running a few minutes late. We have had some technical issues, true COVID pandemic style. We've got a great lineup of speakers tonight. And just to say that I am standing in for Kelly Duplessis, who's still joining the webinar, but unfortunately she's unwell. And we're going to kick off straight away because we've already lost some time. We're going to kick off with Joanne Arends, who is a warrior of stage 4 metastatic breast cancer. I'm going to leave it to her to tell you her story in her words, and she is going to give us a patient perspective on metastatic breast cancer. Over to you, Joanne.
Okay. Hi, everybody. Thank you for that introduction, Dr. Helen. My name is Joanne Arends. I was diagnosed in 2016 at the age of 34 with stage 4 metastatic breast cancer. Those of you who do know what metastatic breast cancer is, it's cancer that has already metastasized throughout the body and attached itself to other organs in your body. And my cancer had started in my breast, which is the primary cancer, but had spread to my liver as well as to my spine. I think this was a very huge shock for me. I don't have a family history with breast cancer, let alone trying to wrap my mind and educate myself in terms of what metastatic breast cancer would mean for me, for my family. I am a mom to a now 14-year-old son. He was 9 at the time. He's 13 now, going on 14, sorry. He was 9 years old at the time I was diagnosed. I'm a daughter to wonderful parents, a sister, a friend. And, you know, my support ultimately came from my family and now extended family. When I was diagnosed, I went through the process of understanding what this disease would mean and how it would impact on my life and my lifestyle. I was a businesswoman at the time and a single mom, very active physically with my sports and athletics, and had a very whole and happy life. Cancer has somewhat changed that, but also strangely enriched that. I say this because my circle and my life, as I knew it before cancer, has drastically changed. You know, I've met such remarkable women along this journey who have held me up when I could not stand on my own, and have accepted me at my lowest and on my weak days, you know. With metastatic breast cancer, the end result is not as any other breast cancer I would have seen on TV or read about. Even in my friend circle, you know, a close friend of mine lost her mother to breast cancer, but her journey was totally different to mine, so I didn't know what to expect. For instance, you would know a lot of women would go for reconstructive surgery or have chemotherapy and radiation, and then, you know, have the hopeful possibility of remission, or, you know, the cancer being completely gone for the next 12 years of their lives. with metastatic cancer, it means treating and managing the disease. You know, I think I'm still taken aback when people say, "Oh, but you look fine. You've been in remission for so long, Joanne. You're doing well." The word remission is very hard for me to use or to even hear, because the possibility thereof for a metastatic breast cancer patient is not as likely. Yes, there's no longer the fear or the daunting fear that stage 4 means death. You know, I have met women who've walked this journey for 20 years and are still strong and vibrant and keep, you know, charging onward. And I take strength and courage when I see them and hear their testimonies through forums like the Breast Health Foundation, Bosom Buddies, Meta Buddies. There's a community of resources. There's a community of sisterhood that has really inspired me and transformed my life. In 2017, I landed in ICU for 6 weeks. The treatment had really damaged my body. I was in hospital with heart failure. I had fluid buildup around my lungs, and my port had, I think the mismanagement of my port caused septicemia throughout my body. So I was bedridden and really just asking God for another chance to not put things off for another day, to tuck my son in at night. You know, those tedious tasks that I think we used to moan and groan about. I just prayed for another day of that. You know, the school trips, the camping trips, the travel, all these experiences that I enjoy, just the opportunity to run another 5K. I just prayed for those, for the opportunity to do that again. And when I did reach the other side of that setback, my doctor asked if I would like to be, you know, put in contact with other women who have been newly diagnosed or women who have walked this journey for a while. And initially it wasn't something I was open to, but I think 6 months into it, I found myself at my first luncheon and met Louise and the ladies from the Breast Health Foundation. I also met Marlies from Novartis. I met now one of my close friends, Jo Moller and Van der Molen. And, you know, I think being around other women who've gone through it or is going through it, as well as women who understand, because your close circle, your support system, it's not all, I don't always feel fair burdening them with my low days and with the difficult or hardships that this disease, you know, brings forth in my life. This year, 2020 started off really tricky for me. I had disease progression in my right breast, where the tumor had previously disappeared. It repopped or regrew, and I had to start chemotherapy again. And this was the third time I had disease progression and had to go through chemotherapy again. So I think, you know, with every setback, there's a level of guilt as a patient, where you feel like this disease and having to share this news with your loved ones is, yes, it's disappointing to me, but I hate burdening them with this news, because I almost feel and sense my family just bracing themselves, you know, for the difficulty they've seen me go through, being in ICU and being really ill, let alone putting my child through having to see me lose my hair again, lose my eyebrows, struggle with mobility or water retention or whatever side effects the disease brought or the treatment brought. My doctor tried to find a less invasive treatment for me to go on to. And in January, I started Navalbine, which is an oral form of chemotherapy. And I must say it was more palatable, you know, other than the fatigue. I was, for all purposes, good to go, still full-time at work, going on about holding things together. When COVID-19, when the pandemic started in March of this year, you know, and we went into lockdown, I was initially relieved at the fact that I can, you know, I can rest, I can take a beat and just sit still and take some stock on my life, and also go through the process of chemotherapy, as well as allow my body to heal. And so it's been a really testy but good time, I think, going through lockdown, which I know was difficult on the economy and difficult in terms of the fear that you as a breast cancer patient deal with, because, you know, every trip to the shops, every time I had to leave the door and go outside into the world, I was really overwhelmed with anxiety and the fear that if I get or contract COVID-19, it's so much harder for someone with a compromised immune system to recover from than for the average, you know, 38-year-old woman. Through this anxiety and this fear that I had every time I went outside, I found myself withdrawing even more and more socially. You know, not connecting with my family, not connecting with my friends, really just isolating myself from even the things that I found joy and wholeness within. With the result that I, for the first time in my adult life, really struggled with depression. And thanks to the support of, once again, the ladies in the Breast Health Foundation, I found myself on a telephone call, a webinar session with a life coach, Pietra Laranja. Pietra, I know that you guys know who I'm speaking of. Anyway, and when she spoke about, you know, how do we take better care of ourselves? She spoke about self-love and self-care. She spoke about, you know, there being strength in acknowledging our shortcomings. There's some strength in acknowledging that you are struggling and that you need help. And I sought help. I am not from necessarily a culture that accepts mental wellness as a reality or as a real struggle or illness, but I sought help, and I've been doing the work. And for the first time, I think not taking the time out to not necessarily not care, but to prioritize me, to prioritize my frame and state of mind, because I'm only of use, to my life and to my circle if I am well and if I am whole, mentally, physically, spiritually. I want to share something with you that I find and take my strength from daily. So I have a daily checklist that I post up inside my bedroom on the mirror, and it's titled Self-Love. And the checklist, I'll just go through the highlights of the checklist, because, as women, we multitask, and every day, every morning is a rush to get out the door and face the world. So step 1, after brushing your teeth in the morning, look in the mirror and say, I love you to yourself. Those are such easy words that roll off the tongue so easily when it comes to our family, our friends, our loved ones, our children, but very seldomly do we say that to ourselves. Before going to bed at night, take 30 minutes of uninterrupted me time. I also started a gratitude journal, where that is the time I take to write down 10 things that I am grateful for. And, by the third item on that list, the fact that I had a good day today. I paid attention, I listened, which is something that I'm personally working on, especially in my interaction with others and my son, that I actively and mindfully listen. So as you start listing these things you're grateful for, the rest just rolls off so easy. And I find new things to be grateful for every day. Item 3, throughout the day, notice negative self-talk and choose to let it go. I am such a champion for the underdog, for, my colleague at work who's having a hard time, or one of my staff members, or my friend that's being ill-treated in a relationship. But when it comes to standing up and taking up for myself, I often avoid confrontation and step away from situations like that. But I've learned to also not engage in the negative subconscious talk, where you constantly, unconsciously put yourself down about your looks, about your accomplishments, about simple mistakes every day. So I've been more mindful of those instances and actually now step back and correct myself and say, no, you're actually not a silly tart for doing that. You are a wonderful superwoman, Jo. Once per day, compliment another woman. And, that is something that I think an insecure person doesn't do very often, but I enjoy. And I think we often notice other things in other women, but never speak up, which is very unfeminist. But I now choose to compliment other women. At mealtimes, eat when you're hungry and stop when you're comfortable. So that's something that I am working on, especially being raised to finish your food and not waste. I now am more mindful and conscious of what I put into my body. Once a day, move your body in a way that's fun, and that, your body posture and how you even just sit and in a braced or closed off position affects your mood, affects your energy, And so I've become a bit more conscious of that and how to adjust that when I notice that I'm shrugging or shielding myself off. And then once per week, say yes to something new. That's very exciting, because every other week, especially during lockdown, I started hiking. And so now my son and my nephew and my sister and I find new hiking spots to enjoy, and just the sense of being out in nature and having a Wi-Fi free day, and how much value and enrichment it's brought to my family, and as well as to my friend circle, because we actually cut off from the world, and we just enjoying being amongst the trees and the earth, and having positive, enriching conversations and connection with one another. So I hope that I have imparted something that adds some hope to your day. And I really thank even Rare Diseases for this platform, as well as for the opportunity to speak with you today. Thank you very much for your time.
Wow, Joanne, where can I start? Thank you so much. I feel like you've just opened your heart to us tonight, and I feel like I'm almost sitting next to you. That was so special and so honest and so real. I mean, and the messages are pouring in. Just thank you for sharing, and just the real inspiration that you are. I could listen to you the whole evening. But thank you so much. And I think what's really struck me is just, the strength that you found in other women yes. that are in the same situation, and just, not wanting to burden your other friends that can't relate. And I think that really spoke. Yeah, and just having lost my own mother-in-law to metastatic breast cancer as well many years ago. But thank you so much. It was so beautiful, and I would just love to meet you.
Thank you.
So we've questions that have come through. Grab a tissue. We've got a few questions. Someone is asking, Alison is asking, is it difficult not being able to take someone with you to do chemo during COVID? Although I guess if you were on the oral formulation, you didn't have to go into the facility.
Yes, I could take those tablets at home, but I still had to go through to Donald Gordon to receive my Herceptin. So Herceptin is an ongoing drug that I have to take every 3 weeks, and the effects of it is not as severe as chemotherapy is, but that in combination to the navalbine that I was taking orally really knocked it out of me. And I think my sister having to sit in the car and wait and not come into the center with me on the days that she could take me. But for the most part, I drove myself. And I would just take a really slow, cautious drive to Parktown. But there was one afternoon where I was stopped by the police twice en route to treatment. And I think, so the doctor's rooms had sent a patient travel letter that I printed out for every trip that I had to make. And having to, tell a random stranger twice in my morning, en route to treatment, that I'm on this road and I'm on my way to receive treatment because I have cancer. And the conversation that unfolds thereafter, you know, it's like, oh, but you look fine. Oh, there's nothing wrong with you. Let me see the letter, you know. By the time I reached Donald Gordon, I was emotionally, I think, just tired and fragile, because I think it all stems back to also, you know, my religious upbringing, and the fact that I've been taught that the power of life and death lies within your tongue. So when you acknowledge weakness and you have to verbalize that I am sick, that you are ultimately condemning yourself to it, you know. And I've come a long way speaking health, life, a strong future and long life over myself. So reaching the doctor's rooms after having to convince two random strangers that I am sick and in need of treatment, therefore I am traveling, really took a toll on me emotionally. It reminded me that, you know, times have really changed. I never imagined that I would have to justify being in a certain place at a certain time. But once again, we are strong women, you know, and we've overcome worse. And, you know, reminding myself of that. Also the fact that the nurses at Donald Gordon Treatment Center are fantastic. And emotionally, one of my favorite nurses there, and I know we're not allowed favorites, but she always finds a vein. She spotted me and said, oh, you don't look all right, you know, do you want to chat? And I appreciate that. I appreciate the fact that they remember your name and they take the time to be kind, which is not
personal.
something we experience in the world every day, or, you know, or everywhere we go. So yeah, there's always a silver lining and a blessing in some challenge. I hope I answered that question.
No, that was perfect. You actually answered another question as well, as to what has kept you motivated. So that was two in one with one stone. Another quick question before we move to our next speaker is, if you had a mastectomy, but she says you don't have to answer if you're feeling uncomfortable, and all the other messages coming through are thank you for sharing, what a powerful story, and you're not alone. So
thank you. No, so I have not had a mastectomy. That's the thing with metastatic breast cancer, is that if I were to remove my breasts and there is a disease progression, meaning another tumor pops up, it will be harder to spot. So no, I haven't had any surgery.
Okay. Well, thank you once again for joining us, and thanks also for mentioning the Breast Health Foundation and Meta Buddies, and also our sponsor tonight, Novartis, and just for this really collaborative effort of bringing us all together onto one page and one screen, just to send out a unified message. So we really appreciate your honesty and for sharing, and thank you for your story. Please do stay on. Yes, Joanne, for the rest of the webinar. We're going to move on to our second speaker now. And I'd now like to introduce Zodwa Sithole, who's the head of advocacy at the Cancer Association of South Africa. So we're shifting now a little bit from the patient perspective and Joanne's story onto the challenges that metastatic breast cancer patients are facing and have faced during this COVID-19 outbreak. And I'm just going to hand over to Zodwa, who has worked in the health sector in various disciplines for many years. She's formally trained in general nursing and midwifery and many other things. And over to you, Zodwa.
Thank you so much. And can you hear me?
We can hear you, but we can't. We can hear you, Zodwa, but we can't see you. Can you switch on your video, please?
It's that it cannot. I think I've got a problem. So you can't see me. Is that maybe?
Okay, that's fine. Just go ahead. Just go ahead
Okay.
without the video.
Okay. No, thank you so much. First, Joanne, thank you so much for sharing. That was so powerful. I think you all know that being diagnosed with metastatic cancer can be overwhelming. You know, you get angry, scared, stressed. And I have seen that in my family. So I'm going to touch on, you know, share my personal story of my sister who passed on because of a metastatic breast cancer. So what happened, you know, like she was angry with herself, she was angry with the doctors. Why didn't they pick up this early enough? So my sister presented with a painful arm. Maybe I must mention that I'm a nurse by profession, and I've done so many courses in my life and training, but I couldn't help my sister. So she presented with a painful arm. For years, she will be changing doctors, and doctors will give her painkillers until this particular doctor said to her, I think, let me send you for mammogram. By that time, she was a stage 4 cancer, cancer. So what was frustrating, so she was protecting her kids. So she said, Zodwa, I don't want anybody to know about my condition. So that was her journey. So I think, I don't know whether it was emotionally, she just went down so quickly after she knew that she had that metastatic breast cancer. So for me, which is really, I just want to highlight the problems, which I think many women who have been diagnosed with metastatic breast cancer are going through. So the main problem for my sister was pain. This is what I want to highlight. She couldn't take the pain. You know, when the pain comes, she will hold on to her mattress and say, Zodwa, I cannot talk. The pain is too much. I wasn't staying with her. I was in Joburg and she was in Durban. And she was scared to take morphine, thinking that she's going to be addicted, scared of the side effects. And her main problem also was constipation. Just also I'm highlighting a few things which I think we as women, as healthcare workers, we really need to advocate for. So I remember this particular Friday, my mom called me. She said, Zodwa, you better come. Your sister is not well. My sister didn't have medical aid. She was going to a public hospital. So Monday morning, I'm here. So I went to the oncology department with her. So my mom is standing next to me. This particular oncologist, she's paged through her file and she said, Liz, sorry, there's nothing we can do for you. The cancer has spread throughout your body. So not even checking how she's taking the medication, you know, like just digging about her pain, finding out more about the pain. So nothing. So when we left that doctor's room, she was very afraid because she died 2 days after that. She was sitting on a wheelchair. So when I wheeled her out, she just turned to me and said, Zodwa, from here, where to? Because we were like hoping that the oncologist is going to help her. I mean, the whole weekend she was in pain and she was taking incorrect dose of morphine. Anyway, so I ended up going to hospice. Mind you, I'm a nurse, I'm trained. We ended up going to hospice to ask if they can help it. So they sent the nurse and they assessed it. They said, no, she needs to be admitted in the inpatient unit. So when we arrived there, so I really want to touch on palliative care a bit. So because when we arrived there, the first thing they made sure, you know, when we brought it for admission, they made sure that she's comfortable. The first thing they attend to, which was pain, and, you know, made her comfortable. And us as a family, because sometimes the family, so like me, it was too much for me to see my sister going through. But for her, I think now and then she was saying, because of her spirituality, she was saying, she used to say, I'm okay, I'm ready to go. So they made her comfortable. I remember myself saying in her dying bed, because I spent the night with her and she passed on early hours of that morning. And I said to myself, God, I wish I can get an opportunity to help other people who are going through this, because if we are being treated by the people we thought they can give us help when we are having problems, I said, I wish God can help me to go out there. And what happened, I ended up joining palliative care. I'm a trained palliative care kind of specialist, because I've spent half of my life doing palliative care, advocating for those patients who are voiceless. So what happened, I just want to touch on something, because people, they got misconception about palliative care. Ladies, or if we do have gentlemen, palliative care is not for the end of life care. It starts when we've been diagnosed with life-threatening illnesses. You know, it provides that holistic care. And also not only for you, also for your family. So that day my sister's kids know that she was diagnosed with cancer, they were finished. But if we didn't get that holistic care, because they look at your spirituality also, you know, like it's what, because like my sister was angry, even with God, why me? I've been such a good person. Why today I have to die of cancer? So those are the things, ladies, I really want to highlight, that really palliative care is a human right. And it doesn't mean that you are going to die tomorrow if you demand that palliative care. Palliative care needs you, it's for you to be comfortable. And also, I just want to touch on something, you know, about managing pain related to cancer. Pain affect your quality of life. So controlling pain is a crucial part of cancer care. It's so important. Let your healthcare providers know about any pain or discomfort you have. You should never feel that you have to endure pain. No, you mustn't. You mustn't. Even pain is mild. It can interfere with your daily life and make other side effects such as fatigue. So it's not a part of, pain mustn't be the part of you. And every visit, ladies, please discuss with the care provider. Discuss about your pain if you've got pain. Your provider can change the type and the dose of pain medication throughout your care in response to your needs. You know, with my palliative care experience, what I know, morphine, you can increase the dose of morphine until the patient is comfortable. Patient only experience the side effects when like he's starting the medication. I know, but after that, the patient is so comfortable. I know patients who are taking morphine, who are driving, who are still working. So that's so important. And also, I would really like to say, be sure to discuss with the oncologist that your pain is not controlled. Hello? Hi, ladies. Can you still hear me?
You. We can still hear you, Zodwa.
Sorry. Okay, thank you. So discuss with your oncologist about your side effects from the pain medication. You're worrying of becoming addicted to the medication. You would like to discuss more how to manage your pain. So those are the things, ladies, which really, if you go to your doctor's room or doctor's appointment, you need to discuss. You don't have to enjoy pain. Please, ladies, palliative care is your human right. So that's why we are advocating for all healthcare providers to be palliative care trained. So in this country, we didn't have a palliative care policy. It was approved in 2017 by the National Health Council. So now we are advocating for that policy to be implemented so that even you go to the private or public, so those health providers, they should be able to give you a holistic care, palliative care, as I've just said, is not only for the end of life care. So that's my story. I wanted just to touch on my personal story and touch on pain management and also on touch on training on healthcare providers on palliative care. And also, it's so exciting that the Cancer Association of South Africa has launched a booklet, a pain booklet, which is we are so excited about it. I cannot even explain how excited I am. We have worked with other specialists in palliative care where like we put this book together, and it's so exciting, I must tell you. And our plan is to translate it into other languages. So it's a simple booklet. It talks about, you know, like, it's simple to read and to follow. It talks about, sorry. So the booklet, it's so simple, ladies. It talks about why do we want to treat pain? Myths about pain. What is causing your pain? What do you do if you have pain? And the general guidelines in using medication. Using of oral morphine, as I've just mentioned earlier on, that many people, they're scared to take morphine, thinking of the side effects. So it talks about how much and when to take your morphine and how to measure out the dose of morphine and the side effects. So we were partners with the Association of Palliative Care Practitioners of South Africa and Untitled Children's Hospice and Patch, who are experts in this. I don't know, ladies, whether you have experience or have seen. I've seen patients with stage 4 cancer, whether it might be breast or whatever, being discharged from the hospital with paracetamol. And also, you find that the patient has been discharged and the referral pathways is not good. Poor patient, not well, they don't have money. And, you know, from the tertiary, they don't even know where to go. Those are the things which we need to help other patients and advocate for. So for me, it's so nice that we are talking like this. Always my concern are the women who doesn't have access to, you know, technology like we do. who helps those women? We are talking about the metastatic breast cancer. Who do they, and Joanne, that was so touchy for me. I was even saying, I wish my sister had met women like you before she passed on. So I think it's something which we need to think about. How do we support those women? And also, just to touch, Joanne has mentioned the challenges of metastatic breast cancer patients during COVID. I'm not going to repeat, but I really want to say one of the stories which was so painful. I mean, one of the women which complained to us, she was in a taxi going for her appointment, and the police or the army, they asked her to go back home because she didn't have the letter which shows that she's going to the hospital. And Joanne mentioned about the psychosocial, I mean, the emotional strain of like not being with your family, going there alone. And some of the patients, they were said, Zodwa, I'm scared. If I die, do you think am I going to be alone? So I won't have my family with me. They won't even come and see me. And in some of the hospitals, you find that, you know, appointments have been postponed because the staff were tested positive themselves, or maybe that the place have to be cleaned because somebody tested positive. I know we don't have enough time. I thought, let me just share those few things with you, ladies. And I'm sorry with technology. I don't know, my video is not working and I had a problem with sound.
No worries.
And thank you so much. Yeah.
Thank you so much, Zodwa. So much passion has come through, and we really appreciate, just again speaking from the heart, and we can really get your passion coming through. And I think you've highlighted such an important issue in palliative care, and the need for that pain management. And I think it really highlights a need for, you know, even more education and spreading awareness about what palliative care is versus end-of-life care, and improving quality of life, and how we as patients and South Africans have a responsibility as well as a right to those services, those palliative care services, and just to ensure that we know what we are, you know, that we can access. And that someone has suggested on the chat group here that it's important to write down, keep a notebook handy and write down all your questions that you want to ask your oncologist, which is a good tip, because we often forget. Once we're in the doctor's office, we might forget the questions that we have. We've got another question just asking about what happens when we do have that bad experience with healthcare workers who don't maybe treat the patients as they should be, which is maybe going to be an exception, but how should that be handled? I mean, do you find that a lot of people will actually follow up with that, and will something happen if they get reported? And then just a second question that's come through, if I can give you them both at once, is can you just share a little bit about if you have any stigma associated with cancer in your community? If you can just, in a really short response, just outline those two before we move on to our last speaker, please. Okay, you're on mute, Zodwa.
I don't know what's happening. So can you hear me now? Okay. So regarding the first question, as Cancer Association, we get a lot of those queries. Like today, I was dealing with a big complaint of the patient somewhere from Eastern Cape. So what we do, so when you call us about any problem when it comes to cancer, we form that particular facility. So what we normally do, and again, we don't want to cause that problem. We start with a facility where the patient was treated. If it is the oncology department, if you are not winning, you move to a higher level, maybe the head of the department or even the CEO. And recently, I'm just waiting for the CEO of one hospital. So we do take, because my role as a cancer advocacy is to deal with those issues. I take the complaints, and I must say, if you say patient has complained, they do listen, but it takes us long time, because one of the problems, I think you all know, that cancer machines are not working. So we get a lot of patients complaining the appointments have been scheduled for January and they've been diagnosed now, but we do take it there. Regarding the second question, the stigma, yes, there is a lot, being wished. And also gender-based violence, because a man would say, I won't have a wife who's got one breast, So those are the issues which I think we need to advocate for. Even working with the traditional health practitioners to say, listen, they need to refer the patients. If patient, they come and present with the symptoms of cancer. So we are in the process of training the traditional health healer also to be able to help.
That's great. Thank you very much, Zodwa. And thank you very much. And I just do hope that you're all able to stay with us. We are running late and it is 8 o'clock now. We're going to move along. Any questions that you have, please continue to put them in the Q&A and we'll try and answer them live. And if they don't get answered on the webinar, we will ensure that you get a response after the session. So without further ado, I'm going to hand over now to our final speaker, who has stepped in. We are most privileged to have her at the last minute, who stepped in the place of the previous speaker who fell out due to illness. So we have Dr. Carol Ann Benn with us, and she is considered one of the experts in South Africa on breast cancer. And I'm so glad, Dr. Benn, that you made that decision in 1998 and you chose the direction of breast cancer. So I'd just like to hand over to you. There's lots of questions already for you in the Q&A and in the chat. And thanks, Carol. Just go ahead.
Hi, Helen. It's Vernon here. Sorry, Prof is currently just with a patient right now. Okay. As soon as she's ready, I'm going to bring her through. All right.
Okay. Thank you. No problem. What we'll do is I will just run through.
Amongst yourselves.
Okay, we will. So I'm just going to run through a few of the comments and the questions that have been coming in while we've had the other speakers. From Joanne to Zodwa, thank you so much. Such a powerful share. The women I meet through the Breast Health Foundation are a testimony to the disregard for basic kindness in the public medical sector. We need to do better. Naziba says, lovely chat, you ladies rock. And who else? Sorry, there's a lot going on in the chat. A very inspirational, Joe. May you have a great recovery. This is such an important topic. Louise is saying we need to advocate for palliative care for all our patients, and your income should not dictate the care you receive. And that's so true. Thank you for all the advocacy work for palliative care. And what else do we have? We also have questions coming in through from Facebook Live. And I'm just going to read you a couple of those. And I'll put this out to the two panel members that we do have that perhaps can answer this. Question is, hi, my name is Mapule. I would like to know if chronic fatigue is one of the side effects of chemotherapy. I've been having a headache that I can't explain. It's like a cloudy filled headache. I've been feeling dizzy, lightheaded, and her left arm and leg are having tingling and numbness. Could that be attributed to the effects of chemo? I don't know if Zodwa you'd be able to answer, or perhaps from your experience, you could answer, Joanne.
So yes, I still experience fatigue, even though I've just stopped. I've stopped chemotherapy in March of this. I stopped chemotherapy in June of this year because I was fortunate enough to be part of a trial procedure for cryoablation. and we wanted to stop the chemo to make sure that the procedure, to actually properly assess the effects of the procedure on my body. But with chemotherapy, I felt such a mental fog. You know, you go to bed with this heavy head, you wake up with a heavy head. I can attest to the numbing and the tingly feeling in your feet and in your hands, because I used to really, really struggle with that pain, or waking up with your fingers, you know, in a spasm almost, or a spasm in your toes. The doctor later told me that it is part of what, neuropathy. I don't know if I pronounced that correctly, but and there were supplements that he prescribed for me to use that actually helped with the tingling sensation. But in terms of fatigue, you know, I tried everything, even, you know, the little things that were suggested by other women in the support group. For me, ultimately, and I know it may not make sense to you, Mapule, but I found exercising helps with fatigue. You know, even on my worst day where I can't go for a run, I would go for a walk. Or during lockdown, I wasn't allowed to do that. So, you know, I would take the jump rope or do some floor exercises at home. And that helped with the fatigue, you know, just pushing through and allowing your body to not acknowledge the fact that all you want to do is lie down and just do something constructive, do something active that just changes your energy and changes how you feel in that moment. But it does get better. It does get better. I've not always been a fan of taking the constant, you know, pain pill. You know, that's why when Zodwa spoke about her sister not wanting to take morphine, I was on morphine whilst I was in ICU, and just the association with that drug and the fact that, you know, morphine is when they give up on you, is what I've seen in the movies and read, is that, you know, when there's nothing more they can do for you, they give you something to just manage the pain. But, you know, find alternative or herbal alternatives and supplements that you can take. Through Dr. Benn's office, Kiara introduced me to a cream that I could rub and massage into my hands and my feet, that actually helped with the tingling and with pain. I rub that still constantly on my lower back because I have excruciating back pain, specifically in the area where the tumor sits. So yeah, there are a whole host of side effects that we deal with. But, you know, you do get to the other side of this. And I want to encourage you, I'm not making it light or taking it very lightly, because I've been through it, but I know that those challenges are not forever.
Great, thank you so much, Joanne. If I can just follow up with another comment that's come, is saying it's essential, just as you've said, just to, you know, try and stretch your legs and get out for a walk every day and do something. And then perhaps if Zodwa, you could answer this quickly while we still wait for Dr. Benn. From a perspective from, you know, the support societies for cancer in South Africa, There's several women who've really struggled with not having enough funds for travel costs to get to hospital for surgery or for treatment sessions. Are there organizations who would be able to assist them and support them in their travel to get to their treatment? Any feedback on that, Zodwa, please? Okay, Zodwa, you need to just press, we can hear you now. Thanks, great.
Okay, so the Cancer Association's got care homes. So those patients, let me just make an example, like here in case that and patients who are staying from, you know, the big hospital. So they come and stay for 6 weeks in our care homes. So that's the support we give the patient. So then we transport them to the care centers, whether it's maybe Eddington Hospital bed hospital. So that's the support, but we don't give them financially. That's the support we give them. Can afford to pay, they pay, and also those who are on medical aid, I think they can. But those we don't charge anybody if they don't have some means of payment. So yeah, that's the support Cancer Association is giving to the patient.
Okay, great, thank you. I'm just going to follow up again and see if Dr. Benn is going to be able to join us tonight, or if we can potentially make another plan and get a recorded message that we can share with you all from Dr. Benn. But I see her colleague has left the desk and he's no longer there at the moment. So let's delve into the questions again and see if we're going to wrap this up or if we're going to just hold on for another 5. So there seems to be lots of comments coming through saying that chemo has also caused tingling and numbing feeling and the neuropathy, and it stays with many people. Some people are still experiencing up to 2 years after their chemo treatment. There's a question from Louise asking, how are the NGOs working together to change policy for our patients? And I think Zodwa mentioned the important palliative care policy that we're still trying to implement in South Africa. And I think an impact of COVID has meant that all resources have really been primarily redirected to cope with this pandemic. So I think it's going to impact, in some ways, it's going to set us back, you know, in terms of making the progress that we have. I've just had a message that Dr. Benn is going to be joining us in about a minute. So I'm going to reintroduce her again, that she is one of the country's top breast cancer experts. And she really made a decision to follow this path into this specialization with the help of Dr. Myron Lang, who is a breast cancer specialist with 30 years experience and was really her mentor. And she learned so much from him and furthered her love for the subject. And she's since then and subsequently really established breast cancer clinics at 3 other hospitals, Baragwanath, Helen Joseph and Mill Park, in addition to working as a surgeon at Chris Hani. So, okay, I see Dr. Benn is not there. I think we're going to have to make a call here because we're already running extremely late. So I'd once again just like to thank all of our speakers. Thank you for persevering tonight, and I think it was so worth it. I feel like both Zod and Joanne, I felt that you invited us into your homes tonight and shared your hearts and your passion with us. Thank you. If you have any further questions, please send them through to admin@rarediseases.co.za. And we will ensure that any of particularly the clinical questions that have come through, we will forward them through to Dr. Benn. So thank you to everybody that's made this possible, to Novartis for funding the session, and also to the Breast Cancer Foundation, and to the Breast Health Foundation, and A huge thank you to colleagues at Rare Diseases South Africa for making this possible on the technical side, and we look forward to connecting with you further. Thanks to everybody, and good night.
Hi, everyone. Sorry, Prof is here now.
Okay, Kelly, what do you want to do?
I think if Prof is happy to carry on, Helen, I'll continue to facilitate.
Okay.
So you have to go.
Okay, thanks. Prof. Benn, over to you. We still have 55 online, so we have a ready waiting audience.
Okay, so I don't really want to mess up your program. I've got about 4 patients waiting still to see me. So if we're in the middle of your program and you want to continue and call me when you're finished, that actually suits me better. So it's what suits you guys.
Oh, no, Prof. Actually, Helen had just almost closed because we weren't sure if you were going to make it, and we know that you are super busy with patients. But if you are willing to just give us 5 or 10 minutes now, that would be amazing.
Absolutely. Okay, so what I was actually busy doing is chatting to a lady who I put in a separate room, and she came in because I could see she's on a medical age. She's got locally advanced breast cancer, and it's everywhere. And she's trying to get in and someone to look after her at Joburg. Okay. And for me, okay, it's really time, okay, that there's a lot more care. And when I say palliation, I don't mean palliation end of life, but care around people with metastatic breast cancer, because it is unacceptable that no one explains things to people, offers them access to trial, offers them quality care, okay? And the comment she gets from a young doctor, she says, please, can I get your phone number? Was, what are you trying to stalk me? So here's a poor lady who's just trying to put together pieces to save as much quality care in her life. So as a Met Buddy point of view, you guys have a heap load of work to do to make sure that we look after our ladies and all our patients, actually. Okay, questions?
Okay, Prof. Sorry, there has actually been, there's been quite a few, largely related to treatments. I'm now just, Helen was facilitating, but I'm going to try jump in. One of them is that I'm really concerned that certain chemo drugs have been unavailable during COVID. Secondly, what is being done to advocate for more of the latest breast cancer chemo drugs to become available in South Africa? And I think that speaks to your point on...
I'm just going to make notes. I'll answer them all. Okay. So let me just, do you want me to answer those 2 and then you can hit me with some others?
Yeah, perfect.
Okay. So I think it is of concern that chemo drugs and even simple drugs such as endocrine treatments have not been available around, let's just say we have BC and COVID is here. So let's call it lockdown, okay? And I think it is a problem not just in South Africa, but the whole world. So I don't think it is your biggest pressing problem. And in all places around the world, obviously more in places which are low socioeconomic and where things are imported in and not produced, we'd have hassles with not receiving drugs. But if we look at a lot of the studies that we're seeing in different places in the world, it wasn't an uncommon problem. So it's not a South African problem. I think what your second question is, for me, more important, and that's the question around access to drugs and important new developments that are happening around. And as we know, and I always use the example of Herceptin, that if you go back and look at the history of where oncology started in 1952, it was around inflammatory breast cancers. The surgeons were king. They chopped off the breast, and because these cancers came back in the skin, what they did was they sent the patients to the nerdy oncologist who had 5 drugs and whacked the patients with drugs. And oncology is always around side effect versus death. Okay, so it's for that reason on a lot of the medical breakthroughs are always tried and tested on people in the metastatic setting. So this is not a bad thing, because the way medical research goes today, it's got to have a equivalent to, okay, and it's very strictly organized, or better than. And I think we have such a diverse and different population group here. So I think we need to push more from a pharmaceuticals point of view, not just doing drugs trials in the US and in the UK and in Europe, but to do them in Africa, to do them on metastatic patients in Africa, because we have different genetics, different medical, so that we can actually see how to make things better for our patients. And I think particularly we need to offer these, and we need to make sure that we have good ethical research units to our government patients, okay? Then there's the next question around cost of medication. And I think now, I was speaking to Devin, it's a pity he couldn't be on, because he'd be far smarter and brighter at answering this than me, is that I think our cost of Herceptin is probably one of the lowest, he thinks, in the world at the moment. Now, it could be sub-phrasing, para-quoting, and getting it not quite right. But I do think cost has to be taken into account, and particularly it mustn't be a case of, if this is the US cost, it must be equivalent here. We need to take into account poverty levels, where people are at, and you need to be able to adjust things. So who wants to be a millionaire? It's all very well for big companies to have multi-million, and it's a bit like what I say with the hospital groups. A 50% profit margin is fine if that's what you want for your shareholders, but it's not fine in a recession. Okay, so I'm a bit of a socialist on these things, and I have quite strong views. You can argue my views, and a lot of people will disagree with them, but I do think that we must cost adjust our medication. So healthcare, which is a fundamental human right, is available to more people. Okay, next question.
I couldn't agree with you more, Prof, in that regard. I think as an advocacy group, I think we know, just how vital pricing, everything actually comes down to pricing at the end of the day. Pricing defines access, unfortunately. Yeah. A question in terms of access, how vastly different is things from a state sector to a private sector perspective? I know that there has been lots of movement on things like Herceptin, etc., over the last couple of years. But I mean, how vastly different is the patient journey in the two different settings?
Well, hugely different, because Herceptin is only available in the adjuvant setting, not in the neoadjuvant setting. And throughout the world, it should be in the neoadjuvant setting. So why 50 patients in the adjuvant setting should get it and not everyone in the neoadjuvant, I don't know. Okay, why big node negative, triple negative shouldn't start with neoadjuvant chemo and be pushed to have surgery first, I don't know. Why the waiting lists of over a year, okay, for radiation is unacceptable. So these are things that I think have to be addressed. So what else? So the journey is different. I do think I can only talk from how privileged I am to have people like Louise and the navigators for my Helen Joseph patients, because I think that we've gained a little bit from the BC, the lockdown, in that to do virtual and to have more online navigation of patients and change what we're doing. I think that's very important, and can be better in a way. I do think that a journey for somebody who is traveling on a taxi or catching 3 taxis early in the morning to catch a to go to chemo and back, when you might be sitting in the middle chair and someone else is eating and you've got that chemo nausea and you're feeling terrible and you want to throw up and you can't even get out the taxi. These are all huge issues that have to be addressed and adjusted. And that is not just for people in the early cancer setting, it's particularly for people in the metastatic setting. And we need to have less almost, I would think, university control, like that this consortium has run of these trials and it's only in this. I think oncology should be more regionalized, okay, and set up in different units such as Helen Joseph and Edenvale, so that people have better access in their areas to care. with maybe what we need is the academics to be able to online guide and run more virtual MDTs and set up better services for our patients in areas where it's needed. I don't know that I lost the plot on that question, but the journeys are hugely different, never mind the number of drugs available. Okay.
No, thank you. And then just lastly, if you had to give a single piece of advice to a woman who's been diagnosed with metastatic breast cancer, is feeling completely overwhelmed and almost deflated and defeated by the system, and obviously the odds stacked against them, what do you think that would be?
So I think my personal trainer died on Monday. He's a young guy. His name is Obi. He's in his 20s. He doesn't do drugs. He doesn't do steroids. He's a young runner. He had woke up with a headache and had a fit, and he probably had a biliary aneurysm and died. And I think the thing is, and I learn it all the time, is it's one day at a time for everybody. So when we're overwhelmed, and I'm often overwhelmed as we all are, we must just remember that you need to get up and know this is a day given to me, just like with anyone else. But what we want is we don't want people to suffer pain and to suffer bad access. And for me, the biggest thing is hostile hospital environment. And I think we need to encourage people more to record their doctor's conversations. Obviously, recording a conversation is not a reportable to counsel, but I get horrified the hostility of how some people are managed. And it's your body and your responsibility, and you must demand a service. Okay, so we need to push more for demands. We need to make sure that there's supportive care, pain management, and making that people have a journey, no matter what your journey is and no matter what the distance you're covering. What you really, really want is you want that journey to be comfortable. You don't want to be going on a bumpy little road. You want it to be in a relatively decent vehicle for your journey. And I think that's what we want for people.
Shane, thanks so much, Prof. I know that you're super busy. We'll let you get back to your patients. Thanks so much for joining us. Yeah. And yeah, it's just always such a pleasure to chat with you.
Okay, thanks, guys.
Yes. So everyone, thank you so much. I'm going to, you're not going to be able to see me. Shame, yeah, thanks. Well, thanks once again to everybody for joining. I hope you guys have really got some good insights in this meeting. And for those of you who are out there that are feeling discouraged, I hope that you can see there is great passion in the room in terms of our speakers tonight. And I mean, Prof. Benn always, it just exudes such hope when speaking. So thank you so much. And thanks to all of our speakers once again. Thanks to everyone who's joined us. Thanks to Novartis for making this, this webinar possible. And we look forward to engaging with you all at a future date. So yeah, I'll let you get off to your families. Thanks so much, everyone. Hope you have a good evening further.